super happy to have Dr. Vokshoor here. He did a short version of this in, I guess it was last year. Gosh, last year went so quickly, didn't it? It went really quick. And I know you've had a super long day in the operating room, so I appreciate you taking your time with your patients and showing up a little late to this, because I know that you give them all of your attention. So we've got some super interesting things to talk about, but I think first it would be really helpful to just talk about, I mean, you're trained as a neurosurgeon. And so a lot of people, when they think about spine, it might be in the orthopedic field. And so, I mean, so neurosurgery, that means that you did how many years of residency fellowship after medical school?
I was one of the last years. Actually, I was in this, I think I was the same class as Dr. Sanjay Gupta from CNN, or maybe 2 classes after, but we were one of the last years of having a 6-year program for neurosurgery. After that, it became 7 and 8, and you had to get a PhD. It just became more and more complicated. So I actually got lucky, 6-year program in residency after 4 years of medical school and college, of course.
Yeah, so it's definitely a long path. So can you tell us a little bit about how long you've been at St. John's, and then kind of like what your practice is and what the difference is between spine surgeons that come from neurosurgery and those that come from orthopedics, and kind of like the main things that you treat?
So I am a practicing neurosurgeon. Since early days in medical school, when I actually thought I was going to be an orthopedic surgeon, I loved spine surgery or just spine anatomy, shape, the fact that all these joints have to kind of work together to give us our erect posture, and how different body types are basically based on different spinal curvatures. I always tell people Dr. Grunwald makes people beautiful on the outside, but your insides, your foundation is still your spine. And to have a beautiful posture, which, as you guys well know from your athletic proclivity, it depends a lot on your spine. So and then like right around 2nd or 3rd year, I mean, I knew I loved neuroanatomy. I mean, the anatomy of the brain still to this day, hands down, is the most fascinating thing I've ever encountered. And so that kind of like the basis of my path and my research and my passion has always been like, how does this like 3 pounds of jelly with all of its beautiful floral-like connections and configurations, how is this designed to give us, that's a cute cat, Susanna, give us the same like the same energy that gives us thoughts and feelings and cognitive power is the same energy that gives us motion and ability to run with a certain style and ability to dance or jump in a certain style. And the stylistic part of it was always really interesting to me, because a component of it is skeletal and a component of it is purely like the operating system and the way it's wired. So I found that interesting, fascinating. And I said, okay, I get to be a spine surgeon as a neurosurgeon, and I get to kind of revel in the field of how the brain and the spinal cord and the entire connectome makes everything happen, including our reality, including our narrative, including our entire basis of life and consciousness. And it can get super esoteric and spiritual in that direction. But I just found it like to be such a great grounding thing for me, where I could be, philosophical and poetic and artistic as a researcher and as a curious human being. And I could have a vocation that I loved, which is spine surgery, as you know.
I love that. I love how you bring all of that together, and you do make it sound poetic, how the brain and the spine work together. So what's the, like maybe like the top 3 kind of patients that you see? What do they come to you with, and what do you do for them?
So I would say, as a surgeon, the best part of my job is making sense of people's lives through like a catastrophic event in their life. People go call a plumber because something terrible has happened to their house. People come to me usually for pain, and people can have all kinds of pain related to their spine. And this is why I believe like this concept of brain health is so important. When you have spinal dysfunction, if you're depressed due to a emotional situation in your life, your spinal pain can get worse. So people come to me usually with back or neck pain radiating to their arms or legs, or they come with a certain spinal deformity or a skeletal problem in their spine, or some kind of a nerve problem that no one else can diagnose well. So we have to kind of become Sherlock Holmes about what's causing a certain pain. I have a couple of great stories. The last one was published in the Health Matters at St. John's, was about a mom of 4 who had pain for years going to her right abdomen. She'd had almost like 50 opinions about this odd pain going to the abdomen. And she's like one of my star patients. I have so much love and respect for this woman and her fortitude. She finally had an MRI, and it was a tumor compressing on her spinal cord in the thoracic spine. And so me and an oncology surgeon approached it from behind the lung, took the tumor out, and she's fine. It's a benign tumor. It was obviously a very critical and nerve-wracking operation for everyone involved, including myself, because the spinal cord is extremely unforgiving in the mid-thoracic spine. It's like one of the, I would say, the sabotage things of our design in general in our body is like between T5 and T9. I mean, really bad things can happen there, including paralysis. And she's perfect, and she's back with her family. But, she was diagnosed with things like fibromyalgia. She was told she's got postpartum depression, postpartum pain. She was told it's endometriosis. She actually had a diagnosis of endometriosis. And it's possible she had a little bit of endometriosis, but her actual pain was what we call thoracic radiculitis, thoracic radiating pain from the thoracic spine. So it took a lot of investigative, okay, where exactly is the pain? How is it? Is it muscular? Is it neural? Does it get worse with motion? Is it worse in the morning, like arthritis can be? And it takes about like a 20 to 30 questions to just kind of come up with a pattern. And sometimes there is no pattern. So this computer, this 3 pounds of jelly, has learned through trial and error and 20 years of practice to create an algorithm for a pain pattern or a complaint pattern, and then come up with an investigative path, and then come up with a strategy to fix it.
I love that. I love how you pull all of the different things together. And, one of the big things that we're really focusing on at the Women's Health and Wellness Institute is how all of the different parts of healthcare commingle and are intertwined, as you said, right? So that even though you come in with one complaint, it's really important to look at all of the pieces there. And I love that you're doing that. And it is about the mind, body, soul, and emotions, right? They're all so
Absolutely
important.
I have so much respect for what you guys are doing. I think it's, we've talked about this, and even in years past before you had this institute, but I really think it's not only necessary, but the integrative nature of it has been long missing in medicine in general. I think they've had, I think oncologists classically have done a better job integrating their patients, because, when you do have a cancer diagnosis, you really immediately get a sense of, okay, what is this entire journey about? And why do I have to really think about it from multiple standpoints immediately? But I think that should be in every branch of medicine. I think we should integrate a person's mind-body connection and their lifestyle and what they bring with them and what their narrative is. I always say the spine is sort of like a diary of what we've done well and what we've done badly to our body.
That's excellent. It's so true.
You were 16, and that's when you were playing football. That's from the car accident. And there's the macro trauma of life and the micro trauma of life that it's written in your spine, basically.
Yeah, and there's so many great things that I know we're going to touch on later about brain health and psychological health. I think something just really interesting to touch on, because I think everybody knows someone who has back pain. Probably most people know someone who's had back surgeries. A lot of people know people who've had multiple back surgeries or neck surgeries. So one of these myths that that when you and I talked, it's like, this is something that's really out there, is that everybody who has back surgery or spine surgery has a redo surgery and additional surgeries. And is that always it? Do you ever fix it the first time? Like what, can you talk about that a little bit?
Yeah, I mean, I think the worst thing is to think about is like when they say never, ever, ever, ever have back surgery, I have I can count about 10 patients that have lost the ability to move a limb or move at all because they were so scared of spine surgery. And it is scary, but in general, our expertise now with the advent of the best neuroanesthesia possible and the best surgical techniques possible, we're pretty good at estimating a success versus failure rate for someone. And so when someone has, say, spinal stenosis in their neck, you can literally lose the ability to move your arms and legs if the stenosis gets bad enough, or if it causes what we call myelopathy or spinal cord dysfunction. And if the fear of back surgery, due to its bad reputation, which is well deserved in certain scenarios, is so paralyzing that you're just like, absolutely not. I mean, I know an engineer, is a Persian guy that I met when I first got to LA. I was actually working for Kaiser for a few years in the beginning, and I was chief of neurosurgery there, and I was straight out of residency, and I felt like I could absolutely do anything. And he had a relatively complicated cervical operation need, a need for cervical surgery. But I said, go get multiple opinions and then do it. And I don't have to be the one doing it, since you think I'm too young to do such a crazy surgery on you. He waited so long, they had a fall and lost function, lost the ability to walk well. And he had surgeries at Cedars-Sinai, multiple surgeries. And he came back to me like 2 years later with basically a wheelchair. He could walk with a walker a little bit. And I was so saddened that I wasn't convincing enough because I knew that didn't have to be the outcome. So the myth that all spine surgeries are going to go bad and never, ever, ever, ever have surgery is a wrong myth. So we have to bust that myth. At the same time, there are 66 joints in the spine. So when you walk around saying, well, I had a hip replacement, I had a knee replacement, I had a shoulder replacement, you don't say, oh, my skeleton is failing because I've replaced 3 joints. You're becoming bionic slowly because we live in a first world country, and we can replace your joints with our prosthetics that work as good as your joints, hopefully. So in the spine, we have 66 of those that could go bad. So the potential for terrible things is a lot. And that's why considering it should be done in the most prudent fashion. But once in a while, when there's a red flag of impending neurologic demise, like the one I just described, surgery is the most conservative thing. It's the first thing you should do. You don't need physical therapy and a chiropractor and hang upside down and get in a pool and all of that stuff that I do recommend for many, many patients before I recommend surgery. In certain circumstances, I would say probably less than 10% of my entire patient population, surgery is the absolute first thing you should consider. It will be limb saving, life saving. It's what you want. And I think either through lack of policing, lack of good peer review, possibly financial incentives in certain circles, spine surgery has been overutilized in certain states. I mean, there's a significant difference between what you get in Montana and when you get in Beverly Hills for the same exact disc problem, same MRI. So why is that? So, Medicare and CMS look at this, the payers look at this, and they're like, hey, listen, what's going on here? Some of it is based on incentive, and we've looked at these numbers. But ultimately, as you know, Tiffany, like, we're doctors, and we're here to make people make sense of their lives and make them better. So a good doctor will strategize with you, will form a team with you, as you do with your patients. I know for a fact that's what you do. It's like when you form the right kind of healthcare team, the captain of which is the patient, and they understand and they're educated about their problem, then you make good decisions for people's lives. And
it's such an important point. And I just want to say, if anybody has questions, please put them in the chat and we'll kind of get to them at the end. But you're right, we are surgeons, but you want to, as much as I love to operate, you don't want to put somebody through surgery. And whenever I refer someone to you, I always say, like, he's a great surgeon because he doesn't always want to operate on everybody. And I think that's so important. And I say, I use this because, you're a surfer and you have a yoga practice. And I think those things are so important because I feel like you look at a much bigger picture. You're never going to run out of patients to operate on, but I really feel like you do have patients go through those steps. So can you talk about that a little bit? Like, so what's the right number of consultations for somebody to get if they have a spine problem before they commit to surgery? Should they see like 1, 2, 3? Should they see a chiropractor? Like, how does all that work?
Yeah, my line is always, if you're not comfortable with what I've said, feel free to get a second opinion. I give them a list of our local colleagues and some distant colleagues, so there's like absolutely no bias. I think 2 opinions is very reasonable. Some people want to get 3 or 4. Nothing wrong with that. I have an ankle injury myself. I got like 5 opinions, and I got 5 different opinions. The opinions were 5 different ways of treating my ankle problem. So I've become such a better spine surgeon as a result of that, because you have to make these decisions based on a person's entire narrative, their lifestyle, what they want to get out of the surgery, what their goals are, what do they want to go back to. And you have to put that all in perspective, because what spine surgery is lacking is complete restoration guarantee. So what you want is you want your spine back, and you want a motion sparing operation, not a spinal fusion, for example, if you can avoid it. But all we do in spine is either decompress the nerves or stabilize the skeleton. So when somebody's skeleton is unstable, a fusion is indicated, and it's a good thing for that segment, but it can transfer the forces above and below. So I would say 2, maximum 3 opinions is very reasonable. If you have a simple problem, like let's say you have sciatica, a nerve pain that goes from your buttock all the way to your leg, and you have a demonstrated L5-S1 disc herniation causing compression of the S1 nerve root. That's this final, the nerve that literally comes down your buttock, and it comes from a disc herniation right there at L5-S1. So if you have that, and this is like a demonstration of a disc herniation right there. If you have something like this, then I would say the algorithm is simple. You can get an injection, you can have a physical therapy, after 6 weeks to 3 months to even 6 months. As long as you're not getting weak in your foot, you can decide whether to have surgery or not. And you probably don't need a second opinion. It's pretty simple. But obviously, if you want one, and spine problems can be complicated, you want the best surgeon that you have good rapport with. You want a surgeon that you trust. There also is a risk of complications. So as this disc comes out, I literally just encountered this. I encountered a massive disc herniation at L2-3 that as I was taking it out, we had a tiny violation of the lining of the nerve called the dura. The dura is what covers the sac right there in the center. And I used very fine sutures similar to what they do in eye surgery, et cetera, to repair the lining of the nerve. And being a neurosurgeon, we're very familiar with that. But that's a potential complication that can happen after that surgery. And being able to take care of it is really important. And, I'm going to, after this is over, I'm going to go check on her to make sure she can still go home tonight. We might keep her overnight. It should be an outpatient surgery because it's a discectomy. But so I would say 2 or 3 opinions at the most.
And so just kind of following up on that, when someone has a problem and maybe they think it's a herniated disc and they're seeing their primary care doctor, and maybe their primary care doctor recommends physical therapy, or maybe their friend says, no, go see my chiropractor. At what point do you say, like, let me just go get an opinion? And I think people are scared. I mean, I know this about seeing a surgeon because they think they have to sign up. And so a lot of times, I just say, like, look, here are your options. You don't have to do any of them. Like, this is not something that, there's some things for me that it's like, you actually don't have to do this now. I just want you to hear your options, and then let's play this out. So if someone has an issue and they're seeing a chiropractor or going to physical therapy, at what point should they say, like, I should just go see a spine surgeon?
I think that's a great question. And so in certain circumstances, spine surgeons want to see people just for surgery. And some of my colleagues do that. Some of my colleagues review MRIs and say only come in if you absolutely need surgery. And during COVID, that's what we did. We did telehealth for everybody, and then we would only bring them in if they absolutely needed surgery based on their symptoms and their MRI findings. But I would say, in my case and in most other surgeons, if you just want an opinion, there's nothing wrong with getting a surgical opinion. And most spine problems that don't have any red flags, like impending nerve damage from a foot drop, or loss of bowel and bladder function, or tingling in the hands and unsteady gait that's quite severe. Those are, like, I would say, it's some of the early red flags of something that really might need taking care of. Electric shock sensation down your entire spine as soon as you move your neck, or as a result of a fall or something like that. If you don't have any of those red flags, or just severe incapacitating pain in the spine that goes down the arm or leg, or doesn't go down the arm or leg, if you don't have any of those, I would try to divide your spinal problem into 3 tiers. Tier 1 goes away with an Advil and is not affecting your life. Tier 2 needs a chiropractor, needs a physical therapist. It's kind of nagging you. It has affected your life, but you're getting along and it's not driving you mad. Tier 3 is incapacitating pain, impending nerve damage, severe deformity of the spine, or something that is only fixable with surgery, and those red flags. So tier 3 problem, surgery is the most conservative thing to do, or is the most definitive thing to do. And tier 2 is where most people find themselves, is why we have to be Sherlock Holmes. And, should you see a chiropractor? Why not? As long as you don't have any red flags. There are Western allopathic physicians who, including my uncle who's an orthopedic surgeon, who thinks, chiropractors, forget it. I'm not like that. I think there are many, many people who mean well and just want to take care of their patients. And I think if we find ourselves in a silo, it means we've drank our own Kool-Aid way too much. And I want to be of service to all those people when they need neurosurgery on their spine. And I think, chiropractic for the neck without an MRI, if you have any particular scary symptoms like tingling nerve symptoms, get an MRI and then go to a chiropractor. Come to me, get a clearance. Yes, your MRI is okay. Go get a chiropractor. Nothing wrong with that. There are times where people are getting adjusted every day for a spinal problem for 6 months, and that's not helping the problem. So
right, it's affecting the quality of life. So I love that. I think that's great advice. Can you talk a little bit about and I'm not really sure that this is a true thing, but are there spine problems that affect women more than men, or around hormonal shifts, whether that's pregnancy or menopause, by age, or chemically induced? Are there things that are you see more commonly in women?
Absolutely. There are, I would say, and that's why I said one of the myths is flexibility is instability. So more times than not, I've seen women have very lax spines that are getting chiropractic adjustments. They don't seem to help a lot, but they don't necessarily have what we call a connective tissue disorder, because in those circumstances, when somebody's connective tissues are not able to keep their skeleton stable, they may need some kind of stabilization. But my first go-to thing for women is, a lot of times, due to cultural things or due to age or due to whatever, their muscle mass is not strong enough to help their skeleton hold their body up without pain or without dysfunction, without laxity. But laxity, which means motion of the vertebral segments, again, is not necessarily instability. You have to think about the entire motion segment of muscles, tendons, nerves, and the skeleton. But I would say, if I had to, profile the female population in general, there are 2 or 3 things. One of them is additional flexibility, especially in the neck, where we see abnormal motion between the segments more commonly than not. But that abnormality on an X-ray needs to be put in the entire context of someone's physiology. Is it just them, or did this segment become unstable over time? And I think that's
fascinating.
That's absolutely fascinating. The second thing is like briskness of reflexes. I've personally noticed that sometimes females just have brisk reflexes more often than males. And
what does that mean?
Like if you use a reflex hammer to check on the biceps reflex or to break your radialis reflex, or what we call the Hoffman sign, which is a sign to look for spinal cord irritation,
Okay.
a neck problem. Certain females, or at least the larger population of females, can have abnormally brisk reflexes, which people say, oh, that's great. That's great. You know, I have a lot of reflexes, but that sometimes means spinal cord irritation. Sometimes it's completely physiologic, and it comes with an embryologic thing or just the way you're wired. So that's pretty fascinating. So laxity, flexibility, the brisk reflexes.
What about osteoporosis? Does that affect the spine at all?
Absolutely. Absolutely. We actually, so when I was doing my fellowship in Tampa, we were one of the landmark institutes that wrote about osteoporosis and scoliosis surgery and how together they can sort of sabotage the entire plan for a spine surgery. So as you know, osteoporosis is truly a multifaceted disorder, from an absorption problem to a potentially a parathyroid problem, potentially a steroid use problem. It's multifaceted, and I think we're now actually uncovering a lot more about this, about how like the gut absorption of somebody can help them get nutrients to the bone, and what happens to the bony architecture as a result of hormonal changes. And I think like lack of estrogen, a lot of other things can cause this, but I can assure you, like we need to attack that with as much might as we have, with the hormonal support, as well as I would say parathyroid hormone, recombinant parathyroid hormone supplementation, etc. So it doesn't cause fractures of the spine, because after it causes multiple fractures of the spine, there's not great fixes for it. We have a cementing procedure that is miraculous in the short term, but it can't be done at every level in the spine if someone has severe osteoporosis. So I would say severe osteoporosis is one of the most challenging things we deal with.
Wow, so that's great, and there's a lot of prevention in that, right? I mean,
yes.
And it is, again, like one of those things where everything's intertwined: your gut absorption, your hormone levels, what your muscle mass is, and a lot of prevention, so that you're not having to do giant reconstructive surgeries on it.
Huge. And and maybe you can comment on this. Like I've heard it be tied to soda intake, like Coca-Cola, like those types of like syrup, processed sugars, etc. I've heard it be tied to just a certain kind of, like, if you're Caucasian and you're petite and things of that sort. And maybe you can enlighten us on that, but I don't think anyone knows particularly, other than the fact that female hormones play a huge factor in it.
Yeah, I mean, they definitely do, and I think prevention is such a big focus, and looking at all of the systems together, which is what we'll try to do in the institute, so that we can get a whole team of doctors looking at what's going on with a woman and all the different aspects of her life. So can we talk a little bit about brain health? I know you have like a big focus on this, and both with your nonprofit organization, the INI, and Brain Spa. Maybe you'll talk a little bit about that later, but can you talk about working on brain health and psychological health, and how that helps recover from surgery? And is that all surgeries or just spine surgery?
Yeah, and I first of all, I'm not a meditative guru. I don't have any degrees in psychology. I am like literally part of your team, this entire team, and I'd love to even open that conversation to that. I'm just I would say bold enough to say, why not a brain spa? Because we have med spas for other parts of the body, and we take care of our heart and our kidney with certain algorithms and certain things, but no one ever takes care of their brain as an organ. And it is an organ that literally represents us and is the literal representation of us. So it's the only organ that you can actually physiologically change with your thoughts and your breathing. So, and I guess, the cardiovascular system is a little bit like that too, but the kind of hackability of the system was very fascinating to me. And then I had a few patients that had recovered well from their spine surgery, had done well, and then there'd be like a bad real estate deal or a bad financial situation or a divorce or something like that, and their actual spine pain would come back almost in the same way, and we would get an MRI, and there would be nothing new wrong in that area, and everything would look good post-operatively. And I couldn't explain, like, why is that nerve short-circuiting now because of this other problem up here? And that's what got me really interested in it, that if we increase the ability of the overall, I would say cognitive reserve is a great word, Sanjay Gupta and many others.
I love it.
As well. Cognitive reserve, you can call it the gas tank, whatever you want to call it. If we can tap into our cognitive reserve and improve it in any way. So the simplest thing is sleep hygiene, a nutritional plan, an exercise or activity plan, and I would add medical management of the comorbidities that we have. If we have osteoporosis, if we have other hormonal problems, if we have a connective tissue problem, if we have a proclivity for arthritic pain, and then lastly, and I would say most importantly, your mindset. So your mental state of being as another kind of biohacking thing that you can do to your nervous system. I would say those 5 things, what I call the pentad of health, is one of the simplest ways of biohacking into your nervous system, into your brain, and making a difference on a daily basis. And that brings me to my other point that we had discussed before, is every day of your life is either a training day or a recovery day. So I think of all my patients as athletes, even if all they do is walk to get the mail and come back to bed. So your goals for your activity make you that type of athlete. And every day is either a training day, which means you feel okay to do something where you push forward, you get after it, you go for a longer walk, you go for a longer run, you lift a little more, you confuse your muscles with a new routine, or a recovery day. It's a day where you don't feel 100%. It's raining outside. It's 60 degrees in LA, freezing. And you're just not 100%. So you do your deep breathing exercises, and you do breath work, and you do meditation, and you do some purely cognitive tasks where you just do some gentle stretches and you're just recovering. And that was the concept that I needed to be okay with after, my accident with my ankle, where I went from a pretty in shape surfer to, this kind of a depressed doctor scooting around the hospital, operating on a scooter.
Yeah, I remember.
It was a terrible thing. So that's when I came up with this concept of a brain spa, because I was like, I've dealt with like post NFL athletes with concussions. I've dealt with high school athletes with concussions. I've dealt with people that have post-traumatic stress, even, our veterans. And these people don't necessarily want to go to a clinical space to get care. They need care. They need a place to go to. Traditionally, it's either been a church or a bar. They don't have any other place to go to. They either
I love that. Yeah.
Or go, hit the martinis. And I wanted to say, no, there is a health place for this, where people can come to a wellness place. And that was what the idea was born out. And it was somewhere where they can get meditative guidance, they can get supplements and nutritional stuff, but mostly it was self-directed neuroplasticity. You go there so you can be with yourself. You can take a nap, you can rest, you can think, you can not think, you can just do, we have a couple of vibrating chairs where it just like very gently vibrates along your spinal axis to music. So I basically was like, why don't I bring together things that are good for the nervous system based on evidence, and use them in a spa fashion. And I'd love to collaborate with you because you're more of a spa person than I am. I'm definitely a student.
No, but I mean, I love the idea because we both know that you can do the same restorative or reparative surgery on two different patients, and some do great and some don't. And everything is so multidimensional, and maybe it's more in women than in men. I don't know, but I definitely know that you know, women definitely benefit from a lot of these things where you're getting in touch with all the different components that have been damaged from being sick, right? Like it injures your soul. You have to you feel your mortality. You've got to come back from it. And I'd love to hear from anybody who's listening, like things that helped you as you recovered from surgery. But you know, I love your pentad of health. Like I think those things are so important. We want to fix this one thing, but there is so much more to the body. I love your 3 pounds of jelly too.
Right on. I love hearing from everyone. What I would only just try to add is that there's no simple method for everyone. And one of the things that I didn't want to do in this brain spa is saying, this is our method, this is our religion, this is what works. And self-directed neuroplasticity allows for everybody to bring their own individualistic nervous system and see what works for them. And there's no wrong way to go about it. And that's.
So do you just have a bunch of different modalities and things that people try, and then if something speaks to someone or they feel better or it lowers their pain or brings them peace, then that's what they're going to keep doing?
Yeah, I mean, we try to, you know, during COVID, we were closed, by the way. It was, you know, we've actually just charging it back up. And we were going more toward, like, this has been going on, the research is out of France for a long time, like cognitive training with meditation of basically a 6-week program where you learn different breathing techniques, and you're not really getting anything other than virtual reality that kind of brings down your sensory input. And I would say that the biggest thing about it has been what works for one person doesn't work for another person. That's the biggest conclusion that I have gotten from this. So the problem is when you're trying to do good research, good science, you're trying to really limit the variables so everybody gets the same exact thing. And also, you know, every brain comes in with its own preconceived biases, including my own brain. So I was like, how do I get myself unbiased enough or blank enough to start at a resting state that's healthy for recovery? And every one of us, I believe, has their own perfect resting state. In functional MRI technology, they call it the default mode network. The sort of like.
Does that mean you can see it in the MRI when you're there?
Exactly. So when you're daydreaming, yeah. So we've been, you know, we've delved so deep into this. Like, what do we tell people to think of? Like, think of a red apple. Like, everybody think of a red apple for 5 minutes straight, just breathing. There's no great method. So I think this sort of a guided meditation with breath work, it was our attempt in getting everyone to that unbiased blank state. That's when you can actually evaluate the value of a particular therapy to see if it has efficacy for brain function. And we're playing around with a lot of ideas right now. There's actually like a massage method that is being, it's a Korean company that's trying to donate massage chairs, but they call it the brain massage with guided meditation. And they want to know what happens to biomarkers of people undergoing this 6-week therapy on a massage chair. And the biomarkers can be, you know, as you know, cortisol, can be microRNA, can be functional MRI, can be EEG, the electroencephalogram signals of the brain. So there are a lot of people doing great research in this arena of mindfulness. And I didn't want the Brain Spa to be a research place, but we do have to at some point look for evidence so we can help people with evidence-based therapies.
Yeah, I mean, I think it's fascinating, and I wonder if you know, when in breast surgery, at 3 weeks I can kind of let patients get back to full activity. They might be a little slow, but you know that like I have these like paddles and we train for the triathlon. And I wonder in brain surgery if the recoveries, or spine surgery if the recoveries longer, and how much harder that is for people. Is there a range of what that recovery downtime is? And that must be really hard emotionally and psychologically.
100%. It's like a mini marathon. So again, spine surgery and brain surgery have different levels of intensity, and depending on which part of the real estate you're mucking around with, is it cervical spine? Is it the cord versus a nerve root? If it's the lumbar spine is notoriously, because it's in the middle of our trunk, there's more potential trauma and inflammation around the area of the surgery than cervical spine. So it takes longer. Believe it or not, brain surgery sometimes is the easiest thing to recover from, other than just resting. If you have full function, then as long as you're not doing anything way too strenuous, it's actually easier than spine surgery, because there's not a single moment where you don't use your spine. If you don't, if you have your arm in a cast, you can kind of rest your elbow, but unless you want to be bedridden, you can't not use your spine. So that's why it's more challenging to recover. I'd say it takes a good 6 weeks to 3 months to get to your full baseline level of activity, especially if you're an athlete, if you want to run, if you want to golf, if you want to do downhill skiing, if you want to jump. So I would say give yourself a solid 3 months if you're considering surgery. We do have, we have artificial discs that we place in the spine now, where after 2 weeks, I've had people fly to Europe after a week and be okay. So there is that. Like when let me see if I have so this is like an example of a mobile artificial disc, where we now can, restore motion. And it's absolutely fascinating, I would say, chapter in spine surgery, because we don't have to always stabilize the spine. We can just stabilize it enough with motion sparing technology that recovery is actually quite better from. So for that, I would say recovery is shorter, especially if done in the neck. So
okay.
I have patients like emailing me from all over saying like, I'm still good. I'm 10 years out. I'm 15 years out, and they're good. So super excited.
Yeah, and I know you do a lot of surgery under the microscope, which allows you to have smaller incisions, better recovery, fewer complications. I think I don't know how long that's been going on in spine surgery, but we were huge improvement.
We were trained on it as on day one, so we've been doing it for over 20 years. But now it's even less invasive than it was 20 years ago. It's absolutely awesome. And now we also have endoscopic techniques where we can literally sneak outside the spine and shave a disc away from a nerve without really even getting to the spine. I did that today as well, and it was brilliant. You literally you're just making a cut, and all they have to recover from is the cut on the skin, and everything else is done through tubes, and the muscles are pulled aside but not cut. So all the muscles come right back. They're a little bruised, and all you recover from is a cut. So that's
amazing. Well, you are brilliant. That's awesome. So let's talk about spine health, and what is our best exercise to keep our spine healthy? Like, everybody always wants those questions, right? Like I'm a runner because it's so easy, right? You strap on shoes, you go out. Yeah. Like I know that it's not a great thing to do. So what are the best things that we can do to protect our spine as we age?
So spine, as you know, is like not one area. So
66 joints.
Yes, 66 joints, exactly. The lumbar spine, I would say the best thing you can do is gentle squatting for strengthening it, and the chair pose in yoga, where you just like make a
that's so hard.
Chair pose is hard, but doing a version of it without, you don't have to always have your arms up. You can have your arms on your chest and do the chair pose. So in the morning, engaging your back with a chair pose that creates space in your lumbar spine and activates it is very healthy. Gentle squats, your glutea, your butt is the most important supporter of your lower lumbar area, lumbosacral area. So just like we need our shoulder muscle to have a good deltoid, for the shoulder joint to be stable, our hip joint needs the gluteus. So the hip joint and the lumbar spine have a lot of back and forth sensation in common. And a lot of times people, come in looking for me to do a surgery on it. I'm like, no, that's your hip. I can tell. Go see, one of these brilliant orthopedic surgeons that we have here. And so I would say the chair pose or anything that activates the plank pose, if you're able to, with support with your upper body, just holding a plank is very, very healthy. The Sphinx pose, which is holding a plank or your forearm, extremely healthy for the spine. Tiffany,
is that because it's strengthening the core, or are you actually working spine muscles?
No, it's activating the chain that holds the spine together, and then rolling the rhomboids, rolling your shoulders back and down, and avoiding the text neck or the zoom neck or the tech neck that we're all suffering from. I would say. So changing positions in all those joints constantly is very healthy. As a matter of fact, I would say now is a good time for all of us to simply stand up for a second. Do you think?
I think so.
Yeah,
let's stand up.
Yep.
We don't want to stay in one position for too long.
Yeah, and roll rhomboid back and down just 10 times. Activate the cervical thoracic junction.
It feels good.
Yeah, it does a lot of magic.
So when we're all Zooming, we should do this every half an hour?
Yeah, 20 to 30 minutes. I think it's very healthy. Yes. I mean, this darn Zoom culture is not going away. I think we're going to be doing this for a long, long time. But, we sit so much. I mean, we do very abnormal things to our skeleton all the time, because we're not just sitting and relaxing and recovering. We're sitting and we're typing, or we're stressed, or we're talking, or we're, going through our social media or something like that. So I would say a recovery mindset is the only other thing I want to add to this whole biohacking.
Yeah, let's talk about that.
So this is great. I heard about this. Most animals on this planet rest a significant chunk of their life when they're not looking for sex, food, or anything else. Human beings rest only when they're sleeping most of the time. I mean, at least Americans, which is, at least the Europeans have the siesta and other methods. I think we simply need to add active rest to our lifestyle. And I do it myself 2 to 3 times a week for 5 to 15 minutes. Some people take a nap, but an active sort of recovery is great also for our physiology.
Yeah, that's good. I've heard about that as also called a strategic recovery, right? Where you're actually planning just downtime to compensate for all the stuff that you're doing.
Exactly. An active version of that. So you're just, you're sitting with your thoughts and, or you're taking a nap. I mean, I call sleeping, this is from a great writer. Sleeping is like a rinse cycle for our nervous system. So if your sleep gets to the full rinse cycles, getting to stage 1, stage 2, stage 3, stage 4, which is the deep delta waves of the brain, and then you in REM sleep. If you can get the REM sleep a certain number of times per night, you have restful sleep. But if you can get to REM, at 1 p.m., 2 p.m., not Dr. Grunwald's and I schedule, but if you can get there, one more time throughout the day, I really do think it's part of our overall plan for brain health. I really do. And I do practice yoga as well when I can, both in the mornings and at night, or, whenever I get a chance. Even a few moves, I think, activates the body, and then sensing the body at the same time as being with your thoughts without judgment, I think is very healthy.
I think that's fascinating. So we're recommending power naps in the middle of the day to get to REM.
Yes, and somebody just mentioned yoga. Yoga is a great daytime rest. I absolutely agree with that.
And And then there's a question about, you've spoken about stenosis and damaged disc. What about scoliosis and what's involved in straightening someone out?
So there's two great known paths of scoliosis. One is the one we get as kids, as adolescents, that remains with us, and one is the one we get as adults that can worsen when we're older. The one that we get as adults that can worsen when we get older is the one that I deal with, and there are less invasive solutions to straighten a spine out, but it does involve a multi-level fusion and reconstruction. And we do those as well. We do those surgeries as well when it's a tier 3 problem. So when the clinical problem is severe pain or progressive scoliosis, and you feel, crooked to the point that you're not breathing well, you're not walking well, then yeah, absolutely. You need a multi-level, what we call reconstructive fusion. The best thing about right now is we have these minimally invasive techniques where even though we do open the spine with tiny little openings over the multi-levels that the scoliosis is concerned with, we don't have to, I would say, do this massive surgery. It's still, even though it's almost the same amount of time in the OR, a lot of it is getting the x-rays in the perfect position and then tapping like a perfect disc implant in through a tiny opening. So the surgery is less intense physiologically, less intense overall, and it achieves the same goals of straightening the scoliosis. And most of the time, the adult version of scoliosis does happen with stenosis concomitantly. So people come in for stenosis symptoms, they can't walk, they have to sit down all the time, and their body feels crooked. And whether to treat the scoliosis or not is a very important decision, because sometimes you'll be just fine treating the stenosis with a minimally invasive decompression and live with the scoliosis. But sometimes the best decision is to do the scoliosis at the same time. And this is where I think spine surgery has gotten a little out of hand in many of great centers around the country. They jump to treating the entire scoliosis immediately. But because we don't restore the spine to its original function, we give you a perfect x-ray of a mostly metallic construct. So then you have these big rods that are straightening your spine, but not necessarily functional. So you need to be educated as to what that means. And that's why it's really
long-term,
lifestyle-wise. It changes your lifestyle and your everyday chores and everything. So as long as there's a good rapport between the surgeon and the patient, and they understand exactly what they're getting into, then it's perfect. But it's
ask lots of questions is the big thing, right? Be very curious, ask those questions about risk, benefits, what's going on.
Exactly.
This has been super helpful. I'm going to put on the Facebook page, I'll put your contact info and also the brain spa, because I think there's a lot of people with interest in that. And we so appreciate your time. We've got, I think in the next 2 weeks, we've got Janie Grumley talking about some amazing innovations in breast surgery, and Verna Porter talking about dementia and Alzheimer's disease and the increased risk in women. So we definitely have those coming up, but really appreciate your time, Dr. Vokshoor. You are an amazing surgeon, and I love your whole outlook with brain health and psychological health and how it all interacts.
I love what you guys are doing. Huge, mad respect for you, Tiffany, and thank you for having me, and much love to you all. Please contact
Absolutely,
me,
our pleasure.
text me, call me. You know my handles.
It was a great hour. Thank you.
I'll put it down here. Thank you.
Excellent.
Thank you very much.
Absolutely. Great to see everyone.
Take care. Bye-bye.
And,
Thank you.